Hey guys, you've seen Arsenal here, media pharmacist here on YouTube. I'm glad you guys made it to Counsel Time, a new playlist where I delve into a medication and bring you the most important information about it. Today we'll be discussing amlodipine or norvasc. Please subscribe, hit the bell icon below, and like the video now to be informed every time I dissect a specific medication or supplement and really delve into what it is. The key facts about this medication will be discussed, how and when to take it, side effects and how to cope with them, as well as some overall facts that you should know of to becoming an informed consumer when it comes to your medicine. Why? Because your health matters to me and I aspire to see you live your best life possible. It'd mean a lot to me if you hit that like button now so we can begin. Thanks, and without further ado, let's talk amlodipine. Amlodipine is a medicine used to treat high blood pressure, otherwise known as hypertension. What exactly is hypertension? It's a common condition in which the consistent force of blood against your artery walls when your heart beats is high enough that it can cause health problems such as heart disease, for example. Blood pressure is determined both by the amount of blood your heart pumps and the amount of resistance to that blood flow that is present in your arteries. The more blood your heart pumps and the narrower your arteries become, the higher your blood pressure becomes. You can have high blood pressure or hypertension for years without any symptoms. Even without symptoms, damage to blood vessels in your heart continues and can be detected when you get your blood pressure measured. Uncontrolled high blood pressure increases your risk of serious health problems, including heart attack and stroke. So bottom line, if you have high blood pressure, taking amlodipine helps prevent future heart disease, heart attacks, and strokes. Amlodipine is a type of medicine called a calcium channel blocker, and like other calcium channel blockers, amlodipine works in a high blood pressure setting by relaxing and widening blood vessels. This lowers your blood pressure and makes it easier for your heart to pump blood around your body. And in angina or chest pain, amlodipine works by improving the blood supply to your heart, since the chest pain comes on when not enough blood gets to the muscles of the heart, either because the arteries to the heart have become hardened or narrowed. So when amlodipine widens those arteries, more oxygen is able to get to the heart, ultimately preventing chest pain. Let's get into some key facts I want you guys to take away. Amlodipine is available in tablets and capsules. They range from strengths from 2.5 milligrams to 5 and maxed out at 10 milligram quantities. For adults, usually your doctor will have you on 5 milligrams once a day, then possibly work up to a maximum of 10 milligrams daily. For the most part, you can take it at any time of the day, but try to make sure it's around the same time each day. You'll also see that amlodipine comes in a combination. It's often coupled with atorvastatin, benazepril, olmesartan, telmisartan, valsartan, and others. The most common side effects include headache, flushing, feeling tired, and swollen ankles. These usually improve after a few days though. Amlodipine can be called amlodipine besylate, amlodipine maleate, or amlodipine mesylate. This is because the medicine contains another chemical to make it easier for your body to take it up and use it. It doesn't matter what your amlodipine is called, just know that they all work as well as each other. Let's look at how and when to take it. Take amlodipine exactly as your doctor has told you to take it and follow the directions on the label. If you're not sure, check with your doctor or pharmacist, but it's usual to take amlodipine once a day at any time of the day or with or without food. But try to make sure it's around the same time, even if you do feel well, as you'll still be getting the benefits of the medicine when you still feel okay. Also make sure to swallow it whole with a full glass of water. Let's look at some side effects and how to cope with them. Like all medicines, amlodipine can cause side effects, although not everyone gets them. Side effects often improve as your body gets used to the medicine. Keep in mind that the medicine could lower your blood pressure too much, especially when you first use it or if you are dehydrated. So stand up or sit up slowly if you feel lightheaded or dizzy. If you experience headaches when taking it, make sure to rest and drink plenty of fluids. Stay away from drinking too much alcohol and ask your pharmacist to recommend a painkiller for the headache. But know that headaches should usually go away after the first few weeks of taking it. Talk to your doctor if they last longer than a week or are severe. If you experience dizziness, stop what you're doing and sit or lie down until you feel better. If you experience a flushing either of warmth, numbness, or a tingly feeling in any part of your body, try cutting down on coffee, tea, and alcohol. It might help to keep the room cool and to use a fan if you have to. You can also spray your face with cool water or sip cold or iced drinks. The flushing should go away after a few days, and if it doesn't go away or it's causing problems, contact your doctor. If you experience a pounding heartbeat, try to take it at a time when you can sit down or lie down when the symptoms are at their worst. It may also help to cut down on some alcohol, smoking, caffeine, and big meals, as these may actually make the problems worse. And as for swollen ankles, raise your legs when you're sitting down to prevent the swelling. The most important takeaway though is actually knowing when to pick up the phone and contact your doctor when you're on amlodipine. So call your doctor right away if you notice any of these side effects. An allergic reaction, this includes itching or hives, swelling in your face or hands, swelling or tingling in your mouth or throat, chest tightness, and troubled breathing. If you experience lightheadedness, dizziness, fainting, new or worsening chest pain, swelling in your hands, ankles, legs, nausea, and unusual sweating. I know for some the ankle swelling side effect can come as a surprise, and oftentimes it can be mistaken as a separate medical condition warranting a water pill, for example, like Lasix or furosemide, but this may or may not be the case for you, which is why you should talk to your doctor. Another rare side effect can be an enlargement of your gums, which I recommend bringing up too if this has occurred. Usually patients who have poor dental health and a buildup of plaque are actually more at risk for having their gums to enlarge. Some overall general information that I want you to end with is amlodipine starts to work on the day that you start taking it, but it may take a couple of weeks for its full effects to kick in. If you're taking it for high blood pressure, you may not have any symptoms. This is why a high blood pressure is known as a silent killer, because you really don't know if you have it until the numbers on the machine tell you that you do. In this case, you may not feel any different when you take amlodipine, but this doesn't mean that the medicine is not working. It's important that you still keep taking it. I recommend having a blood pressure machine at home that records all of your numbers so that you can be informed and stay informed of the progress that you're experiencing, and that you share those recordings on your follow-up appointments with your doctor. I highly recommend the Omron Silver blood pressure monitor on Amazon. It measures on the upper arm and can store up to 80 readings. It also measures 5 times more data points for consistent and precise readings. I've left the link in the description below to pick it up, so definitely check that out. Also note that amlodipine, like any other medication, that will have drug interactions that you should be aware of too, so I've listed below all those interactions as well. Remember to ask your doctor or pharmacist before using any other medicine, including over-the-counters, vitamins, herbal products, while you're on it. And in addition to helping you keep a healthy blood pressure, know that quitting smoking, cutting down on alcohol, exercising, eating well, managing stress, and having all the necessary vaccines will further promote a healthy blood pressure. I'll have a video that goes over how much each of these factors will lower your blood pressure by, so subscribe not to miss out on that. I hope that this video was informative and helpful to you. I may not have covered everything and all of your questions, so feel free to comment down below what you thought and let me know if you did enjoy the video. Thank you so much for staying tuned all the way to the end of the video, and I hope that this was of value, and as always, see you on the next one.